1 out of every $10 earned in Lee County is supported by Lee Health. That's according to a new study that shows that Lee Health, one of the largest healthcare providers in Florida, is also one of the main economic drivers of Lee County. I'm senior reporter Ryan Kruger, and I sat down one-on-one with the CEO of Lee Health as he talks expansion and privatization. This vacant lot at the intersection of Colonial and Challenger Boulevards in Fort Myers represents Lee Health's plans for the future. The largest healthcare system in Southwest Florida has plans to invest $1.5 billion in capital projects in the coming years.
$1 billion of that is going to be new construction, building new facilities, a new hospital over on Challenger.
The new Lee Health Fort Myers will replace Lee Memorial's longtime home on US 41 in December of 2027. Lee Health CEO Dr. Larry Antonucci says the new hospital will make Lee County healthier and wealthier.
And we anticipate the jobs that'll create will be impressive. You know, over 6,000 new jobs will be created over those next 5 or so years as we continue to expand our services.
A recent report from Camoin Associates finds roughly 10% of economic activity in Lee County is tied to Lee Health. That's not just the doctors and nurses who work in their facilities, but the construction workers building new projects. Antonucci says it's important for Lee Health to keep expanding.
We have to grow with the community, right? As the community grows, we have to grow to meet the needs of the community.
How are the challenges from serving the community?
Well, you know, what we have to do is we've got to do very, very careful demographic studies. We have a whole department of folks that are just looking at data constantly so that we can plan appropriately. The one thing you don't want to do is you don't want to overbuild.
Meanwhile, another group is looking at Lee Health's numbers. That's the Board of County Commissioners. Next month, they're expected to vote on whether or not to move forward with plans for Lee Health to move from a public nonprofit health system to a private one. How would the economic impact change? How would the expansion change if you do end up moving private? Would that be impacted by that?
I don't think it'll be impacted significantly. Obviously, it'll allow us to continue to provide the level of service that we have, the local control, maintaining our safety net status.
Lee Health argues that moving to a private system will allow them to invest in other communities, while competing healthcare providers are planning expansions into Lee County. Critics have argued the plan will hurt patient care, while some county commissioners have publicly questioned the need for a change. Antonucci tells me his team is always looking to the future for the best ways to serve the community.
We're always out there trying to look at the future and trying to anticipate where the population growth is going to be.
Ryan Kruger, Fox 4.